who's our first guest?
We have a very special lady with us tonight. She is the co-founder, president, and director of the Atlanta Center for Children, Dr. Hanan Ayoub-Fadil.
All right, well, without further ado, Dr. Fadil. Let's give it up.
Hi, Doctor.
How you doing, Doc?
How are you?
Thank you.
Thank you.
First, I would like to thank you for inviting me today and
definitely.
giving me the opportunity to deliver our message for the children and their families. So
Absolutely.
Thank you.
Well,
thank you for being
This
here.
is a very important topic, so I'm going to let you ladies take this over.
Yeah,
I'm just going to lay back and listen.
Yeah, I just want to start out by saying what you're doing is wonderful. And for everybody that doesn't know, you know, you are very well known around the community. Can you give us a little gist of about what you do at the community center?
Sure. We are not-for-profit organizations. We have offices in New York, New Jersey, and in Texas. We are dedicated to help children whom they have any kind of learning disabilities, starting from kids with autism all the way to cerebral palsy and others.
Right. Okay. If I was a mother with a child seeking counsel, what type of information would be presented to me?
First, I would like to introduce my team. We work as a team, and we invite the parent and the child, screening them first, and then based on what we observe on the child and his environment, we start giving the information to the parents. So it really depends on each child, because we really feel that individuals are very unique and should be treated so individualized.
Sure.
So.
Do you come across like kids with problems, like say, whatever disorders, when they turn into teenagers, wind up going to drugs or alcohol, that you have to deal with that?
Absolutely, yes.
And is that more of a harder problem to solve, or how does that work?
Again, it depends on the environment that surrounds those children and why we look beyond the behavior. Behavior is just a symptom, but what caused the problem is really what matters. So they could be self-medicating themselves because of too much stress surrounding them, and it really goes back to the parents. That's why we put an emphasis on empowering parents to help their children. Yeah. Without the help of the parents, I don't think the child have a chance to heal.
Well, that's what it all comes down to, the parents, patience of the parents on the kid's problem, whether it's drugs or, you know, mentally disabled. You know, it's a hard thing to deal with.
Absolutely.
It's educating yourself, so, you know, it's great that you have a place that they can go to for that type of information.
No doubt, yes. We are open-minded centers. We believe in anything that works for the child, and we encourage our parents to be open-minded. Parents always have the best answers for their children. So if they think that the alternative medicine does work, then we go with it. We also have the biomedical intervention, and again, it all depends on our screening. So you might be surprised. It could be as simple as gastrointestinal infection. Right. And once you treat this yeast or ongoing infection, the kid becomes completely normal. So it really depends on the child's screening and his environment or her environment.
Wow. In terms of behavior, cognition, socialization, how do you guys address that at the center?
Again, the child, when you see a child having difficulty communicating, for example, or having a behavioral issue, we do focus beyond, you know, the symptoms, and there is many therapeutic and interventional program. It could be as simple as vision problem, and if the child is showing hyperactivity, for example, a vision therapy could help this overcome this hyperactivity. Really? So many children nowadays are having those like symptoms of the ADD, and even adults, and it could be just as simple as a vision problem.
Right.
Ain't it true, like people like ADD and stuff like that, or whatever the terms are, when they get old, like they'll live half their life and they don't even know they got the symptoms, right?
That's true.
As you said, they'll be self-meditating themselves until like they actually clean themselves out. Say, wow, I got bipolar, or I got, you know, I'm dyslexic.
Yeah, a lot of people have no idea that they have things that they just lived with, you know.
Absolutely, and the problem is when you medicate, even if you go to a conventional medical doctor and they put them in antidepressants, so the drug could cause one benefit, but list of side effects.
Right.
That's why when you ask about our research, and we said holistic and alternative medicine, because it's less side effects of, taking herbs and things like that. We are not opposing the conventional medicine. We're just trying to collaborate with conventional medical doctors, and by working together, we will definitely have better answers and better treatment for our patients.
I got a question. How about just to tell people that's watching the show, if their kids are on medicine for antidepressants or something like that, and they're messing around with drugs or alcohol, there's a big consequence to that, right? It could be deadly.
Absolutely.
Why don't you tell what they're facing?
I think the parents should be in charge of those children. They need your help. Parents always have the right answers for their kids. Try to sit down and talk, as simple as talk to your child. What causing him to be a drug addict? And just by venting out and talking to his parents, you might be surprised. It could be as simple as you're not having time for your child, and that will definitely help him save himself the trouble and save the world.
You got to be a friend to your kid, more or less. You got to be a parent.
Absolutely.
But when it comes to a problem like that, I believe that if you talk to the person, instead of yelling at them and punishing them or doing whatever, that is like a rebellion. The kid's going to rebel.
The most important thing for the parent that they have a strong belief for each illness and disease there is a cure. If you put that deep inside of you, you will have a different attitude talking to your child. And like you said, when they grow up, they need more of a friend. And I'm not saying you can be a friend and a parent at the same time. I'm saying open communication, be open-minded, be a good listener, because I tell you from my own experience, my 16 years old doesn't like mom to lecture her. She likes mom to hear and listen what's going on outside, how could she deal with the peer pressure.
Right.
And I am learning that myself.
Find me one teenager in America that likes to hear that at 15 or 16, they'll give you $1 million.
Yeah, really.
I got it, but I'll give it to you. So.
But one more question, which I'm sure a lot of people want to know about, and I wanted to save this till last, because this is usually the first thing that we get into, and it's insurance. What type of things are covered for autism management and different disabilities?
Sure. Usually, if there is a demand, the insurance will be ready to help the patients. And what I recommend that when the patient is not covered for any kind of treatment, they should go and talk openly with their physicians and ask them to participate in this insurance.
Absolutely.
And I think this is the shortest cut to solve the insurance problems, because if the physician are not participating in a certain policy, then this is how it starts, no coverage, and then the turmoil, and you end up paying out of your own pocket.
Right.
And that by itself is a stress, and we see so many parents non-compliant just because of that reason, that the insurance are not covering. Right. So if the patient and the parents think that the treatment belongs to this physician or to these centers, I encourage those parents to go ahead and speak with those physicians to participate in this insurance policy, so they could be covered for their treatment and management.
That's the whole problem with the insurance these days. The doctors give you anything. Oh, you got this? Okay, you take this. Okay, to the work, I'll give you that. You want to get to the root of the problem before you waste, you experiment with all this stuff. And sometimes it messes you up more than helping you.
Absolutely, yeah. So, the whole thing is about collaborating together, working together, be on the same page. And I'm sure both patients and doctors can help each other tremendously if they just open the communication. So don't be scared from your physician. I mean, like you said about the teenage and the parent, why you should be in control, really. It's about your health.
It's a very important thing.
Yes.
Now, do you have a website or MySpace, Facebook, anything out there where anybody can get in touch with you?
Sure. It's www.atlantiscenters.com. This is our main website. And if they have any questions, they could contact me at H.Ayoub, A-Y-O-U-B, @myway.com.
All right, well, great. Well, Dr. Fadil, it was a pleasure having you on the show. Hope to see you in the future, right?
And my team, I would love to.
Tell your husband I said hello.
I will. Thank you so much.
All right, Dr. Fadil.
Right.